Tantor Audio, a division of Recorded Books, presents A Clinician's Guide to Gender-Affirming Care, Working with Transgender and Gender Nonconforming Clients, by Sand C. Chang, Ph.D., Anneliese A. Singh, Ph.D., LPC, and Laura M. Dickey, Ph.D. Narrated by Coleen Marlo. Forward. I'm excited to write this forward for A Clinician's Guide to Gender-Affirming Care, Working with Transgender and Gender Nonconforming Clients. As an Indian American, as a woman, as a trans person, and as a psychologist who advocates for trans-affirming mental health practice, I find this book especially meaningful. Like a growing number of the most fortunate trans people, I live with a level of freedom, respect, and celebration for my whole self that I had never dreamed possible. For example, I reviewed this manuscript while flying to Jacksonville, Florida to take my fiancé, Terry, a trans man, to see my parents, who have been wonderfully affirming of my trans identity, my womanhood, and our engagement. I'm reminded of the song, "What a Wonderful World." However, not everyone in my community has the opportunity to live their lives so freely or fully. We have experienced decades of mistreatment, including at the hands of mental health professionals and other healthcare providers. Rates of suicidality, depression, anxiety, housing insecurity, and other challenges in our community are still at very high levels, while trans visibility is still nascent in our society, and all too often, trans people are still caricatured. Despite all these challenges, as trans people, we are re-emerging from hiding, silence, and invisibility, and taking our rightful place in society. As we do so, disentangling ourselves from oppression, we redefine our personal narratives and our collective story. We do so speaking on the authority of our own individual lived experience, reaching consensus where possible, and creating space for plurality where consensus is neither possible nor desirable. What role do you have in this? We need mental health clinicians to have the awareness, knowledge, and skills to work with our community in affirming ways. But even more importantly, we need mental health clinicians who are well-versed in the community's advocacy needs to develop a more trans-affirming society and world. Whether you are trans or cisgender, this book provides you with the opportunity to engage in introspective work to deepen your understanding of not only the needs of your trans clients, but also of yourself as a clinician working with and advocating alongside them. We are living at a time in trans mental health when we can move beyond basic skills of affirming practice to more advanced and nuanced topics. These topics are, of course, not advanced to the trans people who live with them. Rather, what is being advanced is your understanding, and in turn your ability to deepen your affirmative clinical work. This will allow you to support redimensionalizing and recontextualizing trans identities within complex, holistic human identities, which I believe is crucial to trans happiness. If the topics covered here are advanced, the goal is basic. Being fully embraced and living fulfilling lives must not be luxuries of fortunate trans people, but basic human rights for trans people and for everyone. The authors themselves deserve much credit for the underlying work, raising our basic awareness and bringing us to a point of readiness for this discussion. I have known Drs. Chang, Singh, and Dickey through their long-standing advocacy for trans and gender nonconforming mental health and professional associations, such as the American Psychological Association and the World Professional Association for Transgender Health. I have been continuously impressed by their educational efforts to ensure the trans-affirming practice is foundational practice that all mental health professionals should be able to provide. As I read this book, I believe Drs. Chang, Singh, and Dickey break new ground in trans mental health as they provide a comprehensive approach for mental health professionals that will benefit not only clinicians who are brand new to working with trans clients, but also long-time providers who want to ensure their current skills are in line with the most current and affirming practice, offering both insight and practical solutions to providers of any experience level. Now, the authors guide you, the listener, toward fully understanding trans people as people, and in turn, beginning to have real discussions with them. Having had marginal experiences as a therapy client myself, I think to myself, Now that would be a wonderful world. Meera Krishnan, Ph.D., ABPP. Preface. To our ancestors and transcestors who have paved our paths. To our beautiful and fierce community. To those who have survived. To those who are no longer with us. To those whose names we will never know. To those who have had to make difficult choices. To those who continue to fight against injustice and toward autonomy and resilience. To all the badasses who continually breathe life and renewal into our struggle. To those who lift up their communities. To those who strive to center trans voices. To those who have allowed us to hear their truths, witness their processes, and aid in their healing. The purpose of this book is to provide a deeper knowledge base and practical skills for clinicians providing affirming mental health care to trans clients. Over our years of working with trans clients, as well as navigating our own personal challenges as queer, trans, and non-binary clinicians, we have recognized a need for greater awareness and cultural responsivity to trans people within professional communities. Our aim is to provide you, the listener, with a guide to serving trans clients across many aspects of care that goes beyond an introductory level. We know that many trans clients feel the need to educate their providers in order to receive competent care. We hope to provide a means for you to educate yourself so that your clients do not carry this unnecessary burden. Although the term clinician is used most often in this book, we also use several other terms, sometimes interchangeably, to refer to mental health providers who interact with trans clients, including counselors, therapists, psychotherapists, psychiatrists, somatic practitioners, and healers. This book may also assist other healthcare providers in working with trans clients. As clinicians, we have a great responsibility. We have the capacity to perpetuate harm when operating from a place of ignorance, unchecked privilege, or bias. We also have the capacity to witness and help our clients in powerful ways, to assist in healing not only at the individual level, but also in ways that intervene with systems that deny autonomy and resilience. We see every interaction with clients as an opportunity to contribute to their greater physical, mental, emotional, and spiritual well-being. These are opportunities that we do not want to miss. We have aimed to provide you with basic competencies as well as more advanced skills in dealing with the nuances that many oversimplified depictions of trans identities fail to offer. The field of trans health is rapidly evolving, and continual learning is a necessity. We recognize that advanced training, such as in-person didactic training or participation in consultation groups, may not be accessible to you. This book is based on our many years of collective experience working in the field of trans health, expert consensus, knowledge gained from our respected colleagues, and our own personal experiences. We have made an effort to incorporate evidence-based research with the acknowledgement that this body of research is still small yet growing. Because the research and practice related to trans health is continually evolving, we encourage you to develop a network of colleagues on whom you can rely to keep your knowledge and practice current, and to challenge your approaches to clinical work with trans clients. Whether you are working to build a practice that includes work with trans people, or you have been working with the community for many years, we hope that the information in this book allows you to grow as a provider and ally to the trans community. In our writing, we felt it was important for us to be transparent about our background, positionality, and relationship to this work. Sand is a non-binary, gender-fluid Chinese American, they, them, their. Lore is a white, queer, trans man, he, him, his. Anneliese is a mixed-race, queer, non-binary Sikh, she, her, hers, and they, them, their. We do not speak for all trans clients, as there is no universal truth that represents clients of all gender identities and backgrounds. Although our experiences differ based on our background and work settings, we share a vision for the type of world in which we want our trans clients, loved ones, and communities to live. we envision a world in which trans people can access affirming care from all healthcare providers, a world in which therapeutic and assessment work with trans clients is demystified and thereby liberating, a world in which gates have been replaced by bridges, and the very real factors of anti-trans bias and oppression are, at the very least, understood and ultimately eradicated. We invite you to join us in working toward this vision. Introduction. Throughout this book, we draw from several theoretical frameworks with the perspective that there is no one-size-fits-all approach for working affirmatively with trans clients. A useful overarching question when considering counseling interventions is, what is gender-affirming and culturally affirming for this trans client at this particular time and in this particular socio-political context? This question can remind us that clients not only have different needs based on who they are in the world, for example, cultural intersections such as race, class, religion, but they also need interventions to be tailored to developmental stages and situational factors. What is affirming for one client today may not be the best counseling intervention for the same client at a different time. Similarly, that same counseling intervention may not be appropriate for another client, even if that other client seems to be presenting the same clinical concern. In the following section, we discuss the frameworks that have informed our clinical perspectives. Theoretical foundations of trans-affirming mental health care. Theoretical frameworks incorporated throughout this book include client-centered, inclusive non-binary view of gender, global multicultural, sex positivity, relational, psychodynamic, and attachment theory, family systems, social justice, feminism, intersectionality, trauma-informed and resilience-based, cognitive behavioral therapy, dialectical behavior therapy, acceptance and commitment therapy, developmental. First and foremost, trans-affirming counseling interventions are client-centered. This means that self-determination and autonomy are seen as key in providing affirming care. In simple terms, this means that clients have the right to say who they are. Providers working with trans clients can demonstrate respect for clients' self-determination in many ways. The first requirement, however, is that counselors interrogate the persistent messages they have been socialized with regarding sex and gender. This includes unlearning ways of relating to others that may be automatic or unconscious. For example, you may have to conspicuously replace commonly used expressions, for example, both men and women, with more affirming, inclusive alternatives, for example, people of all genders. Of course, it is important to take into account the ways that a trans client's self-determination may be limited or thwarted by the influences of systems of oppression, from trans prejudice to racism to other oppressions. Another underlying aspect of trans-affirming counseling is an inclusive, non-binary view of gender that challenges the gender binary categories of male, man, masculine, and female, woman, feminine. You will learn the importance of recognizing that although some clients identify with binary genders, that is, identify as men or women, others do not. Some clients may identify as both, neither, or somewhere in the middle. These identities include but are not limited to genderqueer, gender nonconforming, gender neutral, ambigender, gender variant, neutre, and non-binary. A truly inclusive trans-affirming approach to counseling acknowledges and integrates a global and multicultural framework for understanding gender diversity, as gender may be experienced, labeled, and expressed in different ways based on culture and geographic context. Because the dominant narratives of trans health and identity are limited in terms of representation, we aim to center the vastly underrepresented and undervalued needs, experiences, and narratives of trans people of color. The journey of global and multicultural competence includes the self-attitudes we examine, the knowledge we can acquire, and the resulting skills we can develop to affirm the multiple intersections of the cultural identities trans clients have. When we work with trans people in counseling, striving to be inclusive of sexuality is as important as being affirming of the broad range of gender identities and expressions with which clients identify. We emphasize a sex-positive approach that does not pathologize variations from compulsory heteronormativity. A sex-positive approach is one that not only allows for diversity in sexual orientation, for example, gay, bisexual, pansexual, lesbian, straight, queer, but also affirms other dimensions of sexuality, including relational diversity. For example, monogamy, consensual non-monogamy, polyamory, kink, BDSM practices, and a broad spectrum of asexuality. Relational, psychodynamic, and attachment theory perspectives inform some of the interventions you might use with trans clients. One of the key influences of these perspectives is the acknowledgement that the relationship dynamics between you, as clinicians, and the clients with whom you work can greatly affect the course and outcomes of your clinical practice. The feelings trans clients may have about you, traditionally termed transference, your feelings and reactions toward them, traditionally termed countertransference, and the extent to which these dynamics are acknowledged, explored, or managed can be powerful factors that contribute to the success or failure of treatment. The client-provider relationship allows an opportunity to heal previous relational wounds and increase the potential for greater relational fulfillment in the future. For example, many trans clients report having had their identities invalidated by mental health providers. Working from an affirming stance provides an opportunity for clients to have a corrective experience in being accurately mirrored and understood. We also apply a family systems approach and acknowledge the role of social support and influence in shaping clients' experiences. With this approach, we consider interventions that include and target family members, partners, coworkers, friends, and other significant communities, for example, church, school. The theoretical foundations of our approach to trans-affirming counseling include social justice, feminism, and intersectionality. Therefore, we recognize that all social identities are complex. We resist thinking of trans clients as one-dimensional based on their gender identities. In other words, being trans is one aspect of identity among many others. Depending on each person and the particular time in their lives, trans identity and experience may feel more or less salient. Because the intersectional and interactive natures of cultural identities are important influences on our clients' experiences in the world, knowing the gender both influences and is influenced by other significant markers of power and privilege, for example, race, ethnicity, sexual orientation, social class, religion, spirituality, ability status, immigration status, is critical to our work. Trans clients' multiple and intersecting social identities greatly impact their access to resources, vulnerability to discrimination, and experiences with others, including their healthcare providers. Therefore, trans-affirming counseling explores how medical and mental health industrial complexes and related power dynamics may create barriers to accessing appropriate trans-affirming healthcare. Medical and mental health care systems are not exempt from the influences of oppression, capitalism, and consumerism that do not always center the needs of trans clients, and may at times be exploitative. Challenging these systems and advocating for our clients is important when providing trans-affirming counseling. We believe that work with trans clients must be trauma-informed and resilience-based. A trauma-informed approach to working with trans clients requires not only attunement and understanding of the signs, symptoms, and effects of trauma, but also responsiveness to the ways the trauma can be treated or healed or worsened in the course of therapeutic work. As clinicians, we seek to understand the ways the trans clients face and cope with trauma they encounter, whether it be overt, specific incidents, or the cumulative effects of repeated microaggressions. In turn, the ways that we address trauma and coping must include attentiveness toward recognizing and building resilience, including clients' individual and community strengths and resources. Because many trans clients experience trauma while seeking medical and mental health care, our work can be an opportunity to restore positive associations with healthcare providers. We suggest utilizing structured, mindfulness-based approaches such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and acceptance and commitment therapy, ACT, where useful. There are strong links between thoughts, feelings, and behaviors, and to address any one of these aspects of experience in isolation may not be effective for our clients. For example, unhelpful or self-defeating beliefs may need to be challenged and replaced in order to help clients move away from behaviors that are harmful to them. Mindfulness-based approaches are ideal for this. For clients with self-injurious behaviors, for instance, DBT can be an excellent approach. In addition to validating feelings, it provides skills-based alternatives to reduce behaviors that are not in the client's long-term best interest, while reducing the experiences of emotional distress through the development of strengths-based coping mechanisms. A client's stage of identity development should be a consideration in treatment planning and interventions. Therefore, a developmental framework is useful in working with trans clients. Age, generation, and cohort are important to consider with regard to developmental stages. For example, a client who is just coming into an awareness of having a trans identity will have different needs from a client who started their transition 20 years ago. As trans-affirming providers, we endorse the perspective that our clients may benefit from a wide range of approaches, some that call for greater insight and understanding, and others that emphasize more active coping strategies and skills. We can encourage greater awareness of self, others, and the world, while not losing sight of the need for active behavioral interventions and solutions for the challenges our clients face. Concerns related to gender identity or expression and decisions related to different aspects of transition may require a great deal of exploration. However, approaches that encourage insight alone, for example, classical psychoanalysis, are often not the most useful for trans clients, as the reality of anti-trans bias, as well as the need to take actions to cope or seek medical care, require more solution-focused strategies for dealing with client concerns. The structure of the book. We begin each chapter with an overview of content, followed by essential trans-affirming knowledge and case examples that can help you to understand how to apply trans-affirming concepts, skills, and techniques in your clinical practice. You will notice that some of the case examples occur within the context of the clinician-client interactions, while others speak to common experiences trans clients may have in society. As you go through the case examples of counseling interactions, you may imagine yourself in the role of the clinician and ask yourself what you might do similarly or differently. For the case examples that focus on trans client experiences in the world, imagine how you might address these concerns as if you were counseling this client. These foundational concepts and examples are not meant to be exhaustive, but they will help to inform your affirming practice with trans clients. At the end of each chapter, you will find 2 lists, except in Chapter 1, which has 1 list, of reflection questions that are designed to allow you and your clients to explore the material in the chapter in greater depth. The questions for clinicians can be used as a training tool, in a consultation group, or for personal reflection. The questions for clients can be used in session. They are meant to help the client gain insight and for the counselor to further understand and conceptualize the client's concerns. We hope you will find this guide to be practical in terms of building knowledge and skills, as well as inspiring personal and professional growth. This book is divided into 5 parts. Part 1 addresses trans communities and health and context. Chapter 1 explores the ways that our gender training, formal and informal, may permeate the language and actions we engage in when communicating with others. It is important for us to explore the biases, beliefs, and values we hold that may impact our ability to build a trusting and productive relationship with our clients. Chapter 2 addresses the importance of demonstrating humility and prioritizing client self-determination. By exploring our own knowledge and the gaps that exist, we're able to join with our clients in a way that ensures they have a clear understanding of the approach we take in our work with them. Too often, trans clients have been subjected to the expectations of their cisgender, non-transgender counselors. As a result, trans clients have been forced to tell stories about their identity that are not consistent with their lived experience for the purpose of gaining access to care. In prioritizing the self-determination of our clients, we allow the client to set the direction and pace of the work and goals they have set for themselves. In chapters 3 and 4, we explore the context relative to the cultural landscape in the United States and the historical reality of trans healthcare. Understanding the context around which our clients have lived with help us to frame the work we engage in, including trauma-informed and resilience-based work. Chapter 5 focuses on raising awareness and building skills that are necessary for people of all genders and sexualities. Part 2 explores the foundational skills that allow for trans-affirming care. In Chapter 6, we focus on the many roles of the mental health provider. Chapter 7 addresses the importance of applying affirming assessment and diagnostic skills, which then informs treatment interventions and recommendations. In Chapter 8, you will learn about the individual, community-based, and institutional barriers that uphold cisgenderist and heterocentric norms and stigmatize any deviations from them. In Chapter 9, we examine resilience, both individual and community-based, that allows trans people to cope with or overcome adversity. As clinicians, we may aid clients in developing resilience and applying resilience experiences in other parts of their lives to their current concerns. Chapter 10 examines the mental health challenges that trans clients experience that may be distinct from or overlapping with gender concerns. We discuss the ways these clinical concerns can be addressed in a sensitive and affirming way. Part 3 is devoted to deepening an understanding of transition-related care. Chapter 11 lays out different aspects of transition that clinicians should be familiar with, including social, medical, and legal dimensions of transition. Chapter 12 is the most extensive chapter as it contains details of medical transition. For example, hormones, surgery, a sample referral letter, and trans-affirming questions you can explore with clients related to each of these medical interventions. This is followed in Chapter 13 by information about interdisciplinary, collaborative care with providers and trans communities. Development of collaborative resources will help to ensure that we are addressing clients' needs in the context of their social environments. Part 4 goes into greater depth on applications of counseling and psychotherapy and the use of different therapeutic modalities. Chapter 14 examines the ways that we can build an affirmative practice for trans clients in individual counseling. Chapter 15 emphasizes the importance of relationship and family counseling, as our clients' well-being is greatly influenced by their relationships and social systems. Chapter 16 addresses the ways that clients may benefit from group counseling or support, especially during earlier stages of gender exploration and transition. The final 2 chapters in this section, Chapters 17 and 18, explore developmental and lifespan concerns with a consideration of the needs of youth and older adults. Part 5 covers special topics in our work with trans clients. Chapter 19 addresses the importance of creating trans-affirming environments, and Chapter 20 discusses how we, as clinicians, can engage in advocacy. Chapter 21 is centered on the experiences of trans clinicians, which is a topic that has received little attention in the field. This chapter may be informative for cisgender clinicians in ally development. This book was written by and for mental health providers who work with trans clients. We cover topics in ways that center trans clients' needs in our practice. The information covered in each chapter, combined with case examples and reflection questions, will be useful regardless of the amount of experience you have in working with trans communities. It is our sincere hope that the practices we suggest will help to shift the experiences of trans clients and forge connections that allow trans clients to feel understood, respected, and supported. Part 1. Trans Communities and Health in Context. Chapter 1. Challenge your gender training. As you learn to provide trans-affirming care, you will gain not only important knowledge about trans people and communities, but also a greater capacity to self-reflect. In doing so, you will explore your own history with gender and privilege so as to provide trans clients the services they need and deserve. This exploration often involves interrogating your biases and assumptions, unlearning habitual ways of relating, and
Sample complete. Ready to continue?